Hey to all those seeking vibrant health, it's Dr. Rachel Northern here, and I'm continuing this year on the endocrine series for the first quarter of this year. And I first off want to start off is why do I do these talks in the first place? And I consider myself a family wellness chiropractor, and I want not only people to just get out of pain, and symptoms, get over their symptoms, but I also want people to thrive. So I like to also let you know and inform you about other options out there that you have, whether it be in my office or a lot of times for some of these things we're talking about, I'm going to refer out to other people that can help with hormonal issues. But myself as a chiropractor, I want you optimally functioning all the way around. And I'm happy to work with other practitioners. I know I want to stay in my lane in some things, but at the same time, I want you to be informed of your options out there for this information. So today I'm talking about thyroid. The previous video I did, it was about the adrenal glands, and so we're going to kind of they overlap, and that's why we have on here this triangle of like thyroid, gonads, which is your organs for your sex hormones, and then your adrenal glands, and they all work together. And so I tell people the endocrine system is part of the nervous system too. It's endocrine system sends chemical messengers where the nervous system, which my primary work is with, sends your regular communication through your spinal cord, but they need to work together in balance in all things. So I always don't want to say one or the other. We need to try to figure out the whole system and how the why. The main thing as a chiropractor, I want to find the cause of a problem or symptom, not just treat the symptom. And so a lot of this we're talking about today is how to try to get around not just treating symptoms, but let's maybe get back to the core of what's going on. So I was looking around my office before this talk today, and another reason why I do this is I love this Thomas Edison quote saying, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame and the cause and prevention of disease." And that's deep in my philosophy. Let's find out what's going on with the body. Obviously I work with the human frame, with the nervous system. And then one slide I didn't have in here as a chiropractor, we have these nervous system flow, like all these things that the nervous system controls. And the nervous system doesn't just control our pain or numbness. That's the average person walking into a chiropractic office is like, I have a headache, I have numbness in my hands, I have sciatica. That's the number one reason to drive people into the office. I happily take care of those things, and we have really great results with these things under chiropractic treatment. But also, there's that part of the nervous system, which is really 80% of the other part of the nervous system that controls your lungs, your diaphragm, your thyroid, as we're talking about today. And the nerve line that's on the thyroid line is that nerve that helps communicate to the thyroid is your lower cervical, your C6 area in your spine. So I always want to make sure that that nerve is communicating properly to your thyroid, that pathway is free of subluxation and interference. So that is my main scope as a chiropractor, make sure that nervous system is up and running, and then we kind of tackle these other things. So we're going to give you some information today. Hopefully this will be helpful for you. So, have you experienced these things? Fatigue, weight gain, menstrual problems, cycles off, heavier, irregular. A lot of times people who have thyroid issues are cold because that helps with the metabolism. So it's trouble getting warm sometimes, or feel colder. Dry skin, itchy skin. So sometimes lack of bowel movements, again, because your metabolism isn't working as well. A lot of people this is like a flag for a lot of people when they do their Google searches, like, oh, hair loss, excessive hair loss, or hair thinning. That could be a sign. Mood swings, also lots of times related. Most of the time it's more depression. And I think that goes back to the energy again. Infertility can definitely happen. Irregular heartbeat, mental fog, low libido. So a lot of these endocrine symptoms overlap. And like I said, because it's an orchestra, like they balance each other out. So, this definitely can be related to the thyroid. There's not a lot of data out there. There's a lot of data out there on, the adrenal system and all that. So it's like the thyroid is kind of like still they're still working on more things to discover with the thyroid. They know it's very important in the system, but how to address it and bring it back naturally is like kind of a multifaceted approach. So, common things for low thyroid, like we just talked about, most of those symptoms. According, statistically, like 12% of any given population, in the U.S. population particularly, the research says that could have thyroid issues, thyroid symptoms. 1 out of 8 women have been having, issues with thyroid. I see it as a common medication when patients come into the office. There's a lot of people on thyroid medication, usually predominantly low thyroid. So they're supplementing their hormones for their thyroid most of the time they come into the office. Men can have thyroid problems too, and in fact, I've known people that have had thyroid cancer as men. So that is, predominantly women tend to notice the symptoms more, but it can be a male problem as well. So we have just a lot of things related to autoimmune with thyroid, and we'll get a little bit more into that later on. And just a lot of times, unfortunately, it is not diagnosed until it's into the disease or failure state. So as a holistic practitioner, I want to try to catch things before the organs failed, because as a holistic practitioner, I know if we can catch it early enough, we can maybe bring that balance back in, rejuvenate some of the organs. When it's in failure in a disease state, it's pretty much like harder to reverse any of that. So, so first off, I was talking about like this, it all starts with the brain. Everything, endocrine, everything, like I said in the beginning, we got to think about the brain and the hormones that are released in the brain, because those will communicate downward, cascade downward, and also, like I said, your nervous system. And so last video I talked about the hypothalamus, which is a little part of your brain. Then we have the pituitary gland, and that's where a lot of the testing is that the mainstream does is called TSH. They test for thyroid stimulating hormone. So this is a hormone produced, like I said, in the pituitary gland in the brain, and that communicates to the thyroid. And so that's supposed to, say, hey, you're supposed to do X, Y, Z. You're supposed to pick up, release your hormones, do some conversions. And, the other hormones that are released, though, or related to the thyroid are your free T4 and your T3, which, this, T3 is more the active one. We don't need to get into too much details about it, but unfortunately, there's all these other hormones that we can test for in our blood. And majority of the time, I see this all the time when patients come in with their labs and they say, I feel like I have a thyroid issue, and we have a slide on that, and they don't test for these different other hormones. So, that thyroid affects virtually all our systems. So we can say it relates to the heart, the nervous system, autonomic nervous system, bones, our GI system. There's some research talking about how thyroid issues are related back to the gut. We're going to talk a little bit about that. And of course, the metabolism. So this is why it's really important to do like a full comprehensive, make sure to ask for more of a full comprehensive test when you're getting thyroid testing done on your blood work. So when you're going in for your annual exam, or if you're just going in because you have issues with your doctor, I do recommend, if you can find a more functional medicine doctor, holistic, open-minded doctor, that they're more likely to run these other tests. I have a lot of patients that they feel like they have a great rapport with their doctor and they want to keep their doctor, then you can maybe push for these other tests to be done. Now, when the results come back, they might not know what to do with them, and that's where you can ask some of us holistic practitioners to help you with these things. So, have you checked, have you went to a practitioner? A lot of times, if you're not happy with your doctor, say you said, I am having these thyroid issues. I did my Google search and it says this is thyroid, and they're like, oh, you're good. It looks like you're good. Most of the time that's because they only checked your thyroid stimulating hormone. They didn't check what's actually being produced out of your thyroid, so those other hormones. And those other hormones are really what's more accurate of what's going on with your thyroid. Unfortunately, that thyroid, TSH, stimulating hormone only shows up low or in balance when you're, like I said, already in that disease state. So unfortunately, that's like the doctors don't know what to do with it until it's in that state, and then they'll be like, okay, we need to do this medication and that medication. So we're going to give you a couple little things to talk about with that. So another thing is between conventional or your regular MDs, RDOs, the conventional usually they have a tighter or a broader space, actually broader range that they like to have versus functional or holistic practitioners. And so the conventional bases their lab values on the average. So unfortunately, our average person now in the United States and maybe across the world, but I know for sure in the United States, is unhealthy. So we're basing an average on an unhealthy population. So it's saying, oh, you're okay because you're normal, but unfortunately, our standard American diet, sad, everything is making us abnormal. We're actually more in the other end. We have over like 33%, I think, obesity in our country. I've talked about all these stats in the previous talks. You can watch all those. So we know we are not healthy as a country. So you're basing these averages, unfortunately, on unhealthy ranges. So we want optimal ranges as holistic practitioners. So we're going to tighten those ranges up a little bit. Okay, so the things that these are kind of the testing that I recommend, not just the TSH, but let's do free T4, free T3, reverse T3. Then there's the thyroid antibodies, which we want to make sure that it's not throwing off other things. So, we have thyroids relate to a lot of different issues. Like we just talked about all those symptoms. It could be broad across the board. So let's go into some of the causes of problems. So any stress, just like we talked about adrenals last month, the stress related can also, maybe the adrenals are holding their own, but maybe it's trickling down to the thyroid, or maybe the adrenals have failed and now the thyroid's trying to pick up the rest of what's going on in the body. So prolonged stress, mental, all the different aspects of stress. You can watch one of my stress talks to get more details on that and how to see what you can do for self-care there. Autoimmune. So we're going to talk about, a little bit of some of the causes of autoimmune. It's gotten a lot of it's back to like our poor diets. We have these viruses, Lyme's disease, all these other things that are taxing on the body that could cause, prolonged inflammation in the body, or just our diet alone causes inflammation in the body. But sometimes that just inflammation is also attacking that thyroid area. So, there's also mold exposure can cause issues on the thyroid. There's a multitude of things that can cause that. So again, maybe go back to maybe my detox talks about maybe doing those surveys of like, are you toxic? How are ways that we can eliminate toxins in your household to help you with that? And one thing, there is been some great data out there talking about just the gut health and just making sure you have a good gut health. Like, are you, how is your probiotics? How is your good guys in there? Do you have, are you doing good enough fiber and your prebiotics? There's a lot of thing going with the leaky gut, and sometimes those leaky gut is when it's hard to describe, but it's like proteins are getting through the gut because it's not tight enough. And sometimes those proteins look like the thyroid gland if they're not broken down properly and getting into the bloodstream. And then that makes it think like, oh, this is not right. This is the blood, the body's like, well, this is weird. This protein looks weird. It's free floating in the body. Is it coming from the thyroid? And then it starts to attack the thyroid, unfortunately, and start to have issues. So we need to sometimes just tighten up the gut, with diet and other supplements that can help with that. Endocrine disturbing chemicals, which we talked a little bit about in my detox talks and the endocrine thing. So plastics affect us. There's a lot of other things, making sure your anything you put on your skin, your shampoos, your moisturizers, anything that can throw off stuff. Sometimes it's just because you're on a medication and it's actually causing more stress on the thyroid or having a side effect with the thyroid. Just obviously any time where your hormones are changing. So puberty and pregnancy. I had a patient come in just recently that with her pregnancy and some way it was taxing her thyroid, so they had to put her on a little bit of a thyroid medication because her body couldn't keep up with the metabolism of having the baby growing in her at the same time. So there's a lot of things that happen. And then also one little thing that people don't talk about in this is about head trauma. So in my practice, I do a little bit of a cranial work, but a lot of times I'll refer out to craniosacral experts, and they will, like, if you've had a head trauma and that causes disturbance and causes actually structural tension on the pituitary gland, or maybe even, like I said, like the neck area, and that's actually putting structural stress on the body, that could cause that organ to be irritated and throw it off. So sometimes, there's holistic practitioners that did everything and can't figure out why they're balancing out, and then it comes down to a structural problem. And once they get that structural evaluated and rebalanced and take that tension off, all of a sudden they're feeling better. I did have one of my colleagues actually had a C6, and she knew when her thyroid is kind of off. She knew her C6 was time to get adjusted, and when she got adjusted, everything was back on track. So there's interesting, again, about the structural things that people don't think about, particularly the mainstream medicine. So another thing, little side things about, sleep, making sure you are getting adequate sleep. We're having a sleep deprivation in our society. So sleep patterns are really important because it's back to the brain health again. Neurotransmitter, balance, that's important, because it's from the brain. We already talked about that these other things, toxins. The last one on here we didn't talk about is genetics. Some people do have a weakness in their genetic line for thyroid. I'm thankful, praise God for me. I have lots of my mom's had thyroid, been thyroid meds since her 30s. All her sisters, I think, are almost on thyroid meds. And I don't know if it's because I've been a healthier lifestyle once I went to chiropractic college, and since that I have been good on my thyroid balance. So, but there is could be some bucket. You might have a weak buckets on your genes that kind of predisposition you to thyroid issues. So that's that too. So, as I mentioned before, sometimes everybody says you're normal. And if you're really having these symptoms, make sure you need to be your own advocate in your healthcare, especially nowadays. Is kind of where healthcare systems kind of all out of whack, and you're ultimately responsible for your health. And pursuing and being your own advocate, or having someone come beside you, like a holistic practitioner like me, to help advocate for you if you don't understand what's going on, So, so how do we address this? So, first off, I pride myself in trying to do a pretty thorough history. We all could always be better, but I think I do really good on trying to get a history of all over what's going on with your body, not just physically, but lifestyle wise, and trying to address that, doing my physical exam. There's other tests that, functional medicine doctors can do, the thyroid testing, iron panels, the D vitamin, B12 vitamin on here, all your other hormones that we talked about, we're going to talk more about next month, but the stool testing. So we're going to talk about that a little bit. And then iodine. So those are two things that, these other ones are common if people think about these things, but people don't think about the stool. And that's kind of stool testing that you can check for this leaky gut situation. So, and then iodine deficiency. So unfortunately, most of our societies being nutrient deficient in our trace minerals, and iodine is very important mineral or whatever, for our function of our thyroid. It's super important for the iodine to be in our diet, we need to get it externally. We do not produce it, and that's really important. Now, I think everybody thinks about iodine. I think of Gorders maybe, of like third world countries, because they are so nutrient deficient, but our society is getting to the point where we just don't have enough nutrients in our foods because they're overcropped and everything, and we're not eating enough of those green leafies, to get some of this iodine naturally. And so we're kind of falling into almost a third world country if we're not getting enough of this iodine to support the thyroid. I have had patients where we supplement iodine for natural means through like kelp or other rich nutrients, and it's amazing how they perk up and their metabolism perks up and their mental fog goes away, and just by supplementing with iodine. So there's different tricks for that. Let's see what we got. So copper-rich stool, if you have bloating, gas issues, this is maybe another thing that you should do. So even if you don't have thyroid complaints, maybe this is a good test to make sure to do. This is just the levels, as these got a little out of order for TSH. We want them kind of in these ranges. You want to have negative antibodies. That's very important. You don't want any antibodies. Antibodies are saying it's attacking your thyroid. You don't want anything showing up attacking your thyroid. But you want to make sure like your TSH is like 0.5 to 4.5, and your free T4 0.9 to 2.3, and then the free T4 2 to 4.4. So those are the levels, like kind of doing there. Like I said, no antibodies. So the GI, so there is stool, like you can get some different companies that do where you can just do this at home. There's different companies that do that, and you can send in a stool sample and they can give you some of these results. So what you want to look for is if there's any, like, again, antibodies in there. This other newer thing in the last couple of years they've been talking about is this zonulin. I hope I said that right. That's kind of indicative that you're having some imbalance in your gut, or possibly like a leaky gut situation going on. And so you also want to get a report of like how good is your bacteria in that gut field. It'll give you great results here to say, hey, I'm doing really good, or wow, I need to figure out how to boost up this good flora in my good bacteria. And then do you have like bad stuff going on? Do you have candida? Do you have, other bacterias in there that are just kicking out all the good bacteria? And that'll gonna throw off everything too. So that's all the data I have. Like I said, they're still developing information on the thyroid. Some of the things that we do in the office here, filling out assessments, trying to see what symptoms you're coming up with. A lot of times it's not just the thyroid, it's because they communicate back and forth through everything. All these endocrine systems are talking. So sometimes we'll have some thyroid symptoms here, and then we'll have some adrenal symptoms here, and some other female or male hormone symptoms here. And so again, we're going to try to figure out what's the primary of how can we holistically put you back in balance, get you thriving and not just having all these symptoms and living with them, or band-aiding them with a prescription, just kind of forcing the body to do what it's doing. So there's other ways you can get, find out information on us. You can join our Facebook group. It's Vibrant Family, I think. Vibrant Family. It's a private group. So you can try to see what we got for our Facebook. Johnsburg Chiropractic and Wellness Center is on Facebook. I'm posting these. We always move our videos over to our YouTube channel when we're done with posting our videos. So if you can't find any videos on the Johnsburg Chiropractic and Wellness Center Facebook, you can always go to my YouTube channel, which is my name, and we'll have that in the next slide. I also have a book that's kind of Journey to Vibrant Health I wrote a couple of years ago. This is kind of just all the health tips I've given in the office to just like pursue like that vibrant health like I talk about, like just trying to not just survive, but it just helps you think about where you can improve in your health and what things you can do for yourself. So with this, let me see, the next slide should be all my information. So the YouTube channel should be, I think, Dr. Rachel, DCCACCP, and we have like over a couple hundred videos at this point, short ones, longer ones like this one. Like I said, we're here in Johnsburg, so if you're local and you want to come in and make an appointment, you can always text our office number, 815-344-0113, And thanks for joining me today.